Good morning, I'm Dr. Price. I am the medical director and veterinarian at Animal ER Care Central. And today we're going to talk to you about some general questions and answers if your dog is in need of surgery. Some things you'll need to know before your dog has surgery is precisely the surgical procedure that your dog is going to have. And of course, your veterinarian should be able to fill you in on those details. And then it's always a good idea to know what to expect beforehand as far as does your dog need to not be fed, have no water before the procedure, and then make sure you're prepared for post-operative instructions at home, again, of which the veterinarian should go over with you prior to the procedure. Yes, most dogs will need blood work before surgery. Depending on the extent of surgery, the length of surgery, the extensiveness of blood work might vary. But in almost probably every case, to be quite honest, they'll need some level of blood work just to make sure that metabolically they're safe for anesthesia. You know, it really depends what type of surgery it is. If it's a surgery that your general practice veterinarian or your ER veterinarian has performed many times and they're comfortable with that procedure, they may or may not refer for specialty services. Certainly if it's a complicated surgery or a surgery where there might be complications involved, that's when your veterinarian might chat with you about referring you to a specialist. Good question. Lab work is basically to make sure that your pet can handle the anesthetic portion of surgery. So we're looking at kidney values, liver values, blood sugar, electrolytes, and also things like white blood cell count, just to make sure we don't have any increased risk for anesthesia before undergoing the surgical procedure. The entire veterinary team that's in the operating room will be monitoring anesthesia, but the primary monitoring will be with the veterinary technician. In some cases that might be a veterinary specialist technician in anesthesia, but in many cases it's with the staff technician that is so adequately trained in monitoring anesthesia. You know, recovery time is really dependent on the type of surgery. So I'd say anywhere from a few days if it's a minor wound repair versus 10 to 14 days if it's more extensive, like going into the abdomen or more extensive wound repairs. That can be difficult at times because dogs don't want to be still most of the time. So creating a smaller space where they don't have the option to be too mobile is always helpful. And just if you're able to be home more post-operatively, I think that's helpful too. This is a strange time for them. Sometimes they're uncomfortable. And of course, having the limited activity they're not used to. So having some time to spend with them and also having a way to try to confine them somewhat so that they can recover appropriately. Anytime your dog is having surgery, whether it's in our minds a minor or a major surgery, it's a change for the family, and it can cause some stress to the family. So I think if you can make sure to have as much information as you can before the procedure and be prepared for post-operative management of your pet after surgery would be the best way to prepare for a surgical procedure with your pet.